Fala pessoal, tudo bem? A gente está aqui no 8º Congresso da Federação Mundial de Ozonioterapia. Lembra que eu já vou pedir para você o teu like aqui, curte pra gente esse vídeo, compartilha o máximo de pessoas possível para que esse conteúdo que é tão relevante, né, chegue para as outras pessoas e a gente consiga realmente trazer o embasamento científico, que é a proposta da Ozônio Integrale. Hoje nós temos aqui, that's a great honor for me to have you here, Professor Lamberto Re. He's here in Brazil for a journey of presentations, lectures, bringing to us a lot of knowledge, new knowledge. Okay, so Lamberto, thank you very much for your time, for your availability. It's a great honor for us to have you here. You've been here a few times.
Yes, I've been here. I've been here about the first time, I suppose, 20 years ago in Belo Horizonte. And after I have a good relationship with Brazil, because I suppose that here we can find really medical doctors and expertise in the health field that very high level by a scientific point of view, and also many other possibility to share with them. So I am really very happy, and I am honored to be here, because I can find beautiful people that can hear me. I want only transfer the knowledge in my field, in this field, and it is very important for me to do this, to increase the knowledge of all the people that is my friend that invite me.
Perfect, perfect. You are, besides being one of the greatest researchers in ozone therapy worldwide, you are a clinician in Italy,
Yes.
right?
Yes.
Taking this point as a clinician, I'd like to ask you the first question, Lamberto. Why ozone therapy?
So I am a clinician, but before being a clinician, attending people, suffering people, for my first 40 years, I work as a researcher, pure researcher, in the field of pharmacology and neurophysiology. So you can imagine, in my mind, I have a lot of information and a lot of experience just looking at the potential of medical drugs or any other kind of treatment that could be helpful for suffering people. At the end of these 40 years, really, I was asking myself, what are we doing? We know very well receptors, a lot of receptors regulating the earth frequency, regulating the pain, regulating neurological disorders. But really, so far, we have some very rare disease that they can't find a pharmacological remedy. So in that period, some people told me about ozone. And really, with my experience, I was impressed that there is another way, not using the paradigm to use compounds that act on the receptors could be in some way modified with another paradigm, that is to look the body in all holistic way. And when they talk me about ozone is an oxidant, okay, and I asked myself and asked them, and I started a deep study, because I know nothing, only the formula O3. That's a very unstable molecule, because it is very high energy. It needs to maintain 3 atoms of ozone of oxygen together. And when I start my clinician activity, just to test this idea that a small oxidative stress can put a response, an adaptive response from the body with potential incredible in several ailments, neurological and arthrosis, pain, and so on, immune system. So being a clinician now, after 30 years of activity, I can see really that I was really impressed by the positive results. What we need is, what is the relationship exactly by this administration of ozone, oxidative stress, and the clinical response? This is what is a big stimulus for me to go on in the research, in the study, in the literature that we have in the field, because now we have the evidence, we know what is the key of this potential of ozone. If you want, I can speak about this.
Yes, sure.
Sure. And this is, some years ago, about 5 or 6 years ago, there were Professor Bocci was the first with the hypothesis that this small oxidative stress could activate a biochemical pathway that is in one last work that I saw just a few weeks ago, they define evolutionary for the species, for the human. So this pathway is very important in control all many functions of the organism, of our organism, and fix some problems. This is the reason why sometimes giving ozone we can solve one problem that is different from that the patient asked us our help. And we know that there are a lot of studies to do, but this NRF2 is a powerful tool to modulate the expression of some genes. So being a pharmacologist, I know sometimes that if you want to increase the activity of one function, for example, cardiac activity, we have to act to one receptors, that is the beta-adrenergic receptors, giving more adrenaline to increase. Or in the other way, if you want to block this activity, for example, in the case of blood pressure, usually we give a beta blocker that is an antagonist. One compound, this paradigm of the compound that block or activate one function at the end of this line. In the case of an RF2, we act on the beginning because the same gene, if we can modulate the gene can be upregulated and produce more products or downregulated and produce less product. Well, NRF2 is able to do this, just a genetic agonism or a genetic antagonism. So the epigenetic will be the future. And we are looking to find this relationship within the clinics. That is fantastic. I can tell you in my clinic, now we arrive to give the measured blood ozonation to 600 every month.
Wow.
600 treatments every month. And this increased mostly after COVID. That's because the people relieve most of the problem post-COVID, and just like before, because ozone is able to modulate and to repristinate a function that is in some way not good and not working well.
One question. But if we have a suppression of NRF2 and we work with ozone therapy, don't we can provide or can we can give to a patient, for instance, an intoxication with ozone? He's not ready for ozone therapy, or we have a suppression of NRF2.
No. Is the NRF2 is a master regulator. Is a regulator. Is not increase, not decrease, depending on the response of the patient. If the patient he has one problem, for example, some genes express more, or in other way, when you age, for example, at the end of your life, you have the gene of the substantia nigra that produce dopamine, they work less than when you are young. So this is a physiological, sometimes it's a physiological, but if you have some problem in the hereditary problem in that gene, the gene works more or less, giving the illness. The master regulator come back to normal dysfunction. So the gene, probably also the same oxidative stress. So if we have an excess of oxidative stress within one tissue, the DNA of this tissue is suffering. So it produce an altered response, or increase it or reduce it. So instead of use the drugs, the compound to block at the end, our hope is that NRF2 can modulate this gene expression, coming back to the normal, to the physiological condition, a normal expression of that protein.
What about NF-kappa B with NRF2?
So NF-kappa B is another expression of the same line. Usually in the papers, in the review, we don't find exactly NF-kappa B, but NF-kappa B that more is related to pain and to control of pain and to release of mediators of pain is a consequence of the activation of NRF2. Both work just together. in harmonic way. That is very important to do this, but we are at the beginning, I suppose, of a future that will be brilliant. Not only for, these are not my words, but I can find in the literatures, in the big literatures, every day some news that are related to the study of the possibility of how it could be possible that this NRF2 can modulate this gene expression and can at the end modulate also reduce the problem of rare illnesses, for example. We have a lot of illnesses that now, if you see a medical remedy, you can find nothing. So it's not possible to, to, to tell to these people, I have nothing for you. We have an hope now, the possibility. We are not sure about this, but we have an hope. This is more than an hope, because in this way we can really fix a problem without giving side effects. In this case, with ozone, but you're right. What is the concentration that we have to use? We in this oxidative stress. So that is what we have to study also for the future, because so far we don't know if this small oxidative, adequate oxidative stress that is different from person to person is able to activate in a binary way, cioè not in a analogic way. So, for example, a small amount of ozone can modulate NRF2 at 20%, or higher concentration of ozone can modulate 40%. We are not sure about this. And this last paper, they suggest that perhaps it's a binary activation, all or none, like action potential. So if you give one small amount of ozone, the exact concentration of ozone in one person, that person can have the activation or not.
Perfect. I see. Perfect.
And we need to find the right concentration, because if we go over, okay, we can activate, but we can give also side effects.
It's a volume bottom.
Yes, something fantastic, because more complicated, but it's logic. So if I can understand with my experience by neurophysiology and pharmacology, that this tool could work efficiently in people that are without any hope, why not? Study, go on. Yeah. And this is the future. But to be the future in the ozone, we need also to modify some way of expression. For example, we need to forget, it will not easy, but we need to forget completely oxygen ozone therapy. There are two mistakes in 3 words. So oxygen is only the carriers. It's any functional activity when you give injection of ozone by vein, oxygen, because the oxygen must be breath. It's only the carrier of ozone, so nothing. And ozone is a medical resource. So medical ozone treatment could be a therapy, but usually therapy is mandatory for compound taxon receptors with a clear mechanism, pharmacological mechanism. In this case, is a treatment. It's like, for example, is a good nutrition style or a constant physical activity. In this situation, you have a well-being of your body, probably because also in that situation, we found fantastic things, because in nutraceutica, we know that also a good lifestyle and nutrition style modulate the NRF2. So because NRF2, not only ozone can modify this, can activate this line, but there are also compounds. For example, in most of the papers working on this field, they are looking for agonists that can move NRF2 for KEAP1, because normally NRF2 with KEAP1 are inactive, and if don't need to check one problem of oxidative stress, come back to a proteasome and is destroyed every day. But if there is some perturbation that could be pharmacological, could be oxidative, like oxidative stress, nutraceutical, or with physical activity, this NRF2 is free from the bind with KEAP1, go to the DNA in one area that the name is antioxidant response elements that control all the problem of the aging, but not only, all the problem that we can have in our body, neurological, immunitary, and so on, vascular and older because it's a ubiquitary. And this last, I come back to this last paper when they talk evolutionary tool for the species. That means that is the best, that is the future. And so with ozone, we can use one part of this potential, but we need to elevate, to increase our level of knowledge and quality. The fact that we do not have rules. So if you are a medical doctor, if you are a dentistry, if you are a veterinary, you can use ozone, but nobody will ask you, what is your quality? Which kind of ozone are you using? What is the generator that you are? In my speech, and this now in this Congress, this event, we propose a declaration, a card, where are written all what we need to rules ourselves. Good generators, because the first step, if I give something, if I put something inside your body, I must be sure that this is a quality ozone produced by medical oxygen only. This is the first step. And after you have tried it, one doctor, you can't find in the university so far a course in ozone treatment, medical ozone treatment. You can't find. So usually are the same manufacturer of generators that give you the knowledge. It's not enough. We need to increase and to transfer the knowledge and the quality to all the medical doctors that so far they don't think, they are not a good idea about ozone. Some people only for interest, other people just because they don't want, and other because they are not informed. So we need to look to this kind of doctors and explain them what is the potential, why we can help and integrate, not in alternative, but integration. Ozone is fantastic for integrate one clinical specialties, any clinical specialties. And what I am looking for the future is the cooperation with neurologists, with oncologists. I am not oncologist, but in my clinic I have people with oncologic problems. I would be really very happy if the oncologists cooperate with me just to help these people together, not alone. So to do this, we have to explain exactly what is ozone, what is the potential, and what we have now in the literatures. And I am sure that all the doctors, the medical doctors, will do all the best to try to help their patients.
Just coming back a little bit to NRF2, can we activate NRF2 with topical application of ozone or just with systemic application?
So this is a good question. So you know that ozone, we have some protocols where ozone is used at very high concentration for bactericidal, virucidal effects and to sterilize wound. And in that case, obviously, NRF2 is absolutely out of any scientific clinical explanation. But when we give injection, for example, low concentration on the knee, I am sure that also in that case there is an anti-inflammatory and the NF-kappa B is involved, and there is the integration, the activation also of NRF2 is a factor of concentration. Is the right concentration in any tissues can activate this NRF2 that 10 alternatively can increase also the oxygenation of tissues, and the oxygenation of tissue, the release of oxygen to tissues. This was another mistake because at the beginning I remember some colleagues told me, Lamberto also is able to oxygenate the blood. No, only the lung, the alveoli put oxygen on the blood and the hemoglobin. But ozone can only help the release of oxygen to the tissues during the way from the heart to the periphery of our body. That is different. Increase the release of oxygen to tissues. And the blood come back with less oxygen to the lung. This is very important.
Perfect. You say about the concentration, but the volume of ozone is important as well, or what do you say?
Yeah, exactly. The volume is very important. It's very important because if you increase R2, variable directly proportional. How can we do? If we increase one, increase all the final, it will be the concentration multiplied the volume. So if you use the same concentration, but we increase the volume, at the end we increase the amount of ozone. This is very important. So this is the reason why sometimes we have to use, I talk about the measure blood ozonation, the same volume always. And what we change only the concentration. But the volume is very important. Or also in injection, if we inject higher volume, we can have some mechanical problem that can block the functional problem that we can use. There are some things, but it's very important also the volume. So there are many topics to know about this.
It's very deep knowledge.
Yes.
Very deep knowledge.
It is
Just to clarify, so you are proposing the major
blood ozonation,
major blood ozonation, and not major
not autohemotherapy. Yes, the obsolete because autohemotherapy does means like we take the blood, we manipulate the blood, and we put the blood again.
Kind of
This
mysticism.
See that is some people is worried about this, and so this is another reason why we have some negative feedback about ozone. No, just only for the words that you use, not for the technique, because the technique is the same. We take blood, but the blood remains always in our body. Always is a closed circuit. So I take blood, I put ozone, and I put back the ozonated. So this is the right definition is measure blood ozonation. It is measure intended that we use the great volume in respect to the minor blood ozonation, that usually the blood ozonated come back in another way, not in vein, but intramuscularly, just with injection. So it is very important for the future that we use the appropriate terms to be believable. Otherwise, the mistake of always that put us in a angle, in a corner. We are in the corner because we are not believable. We are not using the correct term. We don't have the exact knowledge, and we don't use the right quality to reach the best clinical results. And in this document that we are present here, we propose, because we never forget that every doctor must check before talk with the patients and use the experience to use the best range of concentration. So what we propose is a protocol and the range of concentration, maximum and minimum. You can't go over. In this case, it will be useful for the future for multicentric comparison. So if we use all these protocols, adjusting on a single patient, so increasing or reducing in the range that we indicate in the document, using the same protocol to do a major blood ozonation, a minor blood ozonation, so the clinical result that we obtain in Brazil will be comparable to that obtained in Italy or in China, I don't know. This is very important also to increase our visibility.
We can standard all the procedures.
Sure.
Yeah, perfect. Awesome. My mind is blowing. Awesome. Roberto, one last question for us to finish up here. What about the supplementation of vitamin C and ozone therapy? Can we take both along or not? What do you say?
So, can use it both, but not together. Not together, but not for vitamin C, for ozone. Because the mechanism of ozone is to modify the oxidative stress of your body in the same moment in which it is injected in your body. If we modify this status oxidant with another compound, like vitamin C or any other antioxidant, sure, the response will be different. So we must use nothing that could counteract the mechanism of action of ozone. Ozone is an oxidant with a very high level oxidative stress, use it at adequate concentration, and in this condition, we can have the best response. But if I give you vitamin C, I modify the response, so I am not sure about the result. Later, okay, you can use, not together.
How later? Or how
No, before is better the days. Later could be also. It is important because the effect of the ozone is about in a few milliseconds. It's very rapid. So ozone destroy, come back to oxygen, and one ozone singlet with 2 electrons just in a few microseconds, not milliseconds. So when is reinjected the ozone, the blood in there, we can do vitamin C.
But what about
Before.
the lobes?
Huh?
What about the lobes?
What
The
the-
lipidic oxidative products. Wouldn't it interfere with vitamin C?
No. This was the first idea because now we have the evidence that okay, these lobes it forms, but really since the beginning, also Professor Bocci told this, was the NRF2. There was not discovered at that time. We discovered NRF2 later. And also in my speech, there is just one slide speaking. At the beginning, our idea was there to put ozone and second messenger like peroxide could induce a delayed response. True, but every response to ozone and to this lipoperoxide is through NRF2 pathway.
Perfect. You've been here a few times here in Brazil. How is your Portuguese?
Oh, não falo todavía português. Só falo, não falo, tudo está perfeito. Obrigado. Não, hablo um pouquinho, talvez hago a minha conferência assim, falando português, mas português.
How's your samba?
Samba é um pouquinho viejito, digo não. But I was on myself, so with ozone I can dance samba, seguro, bailando samba como se dice aquí. Me gustaría un día tentar esto bailo tan bonito que lo hago en otra ocasión, mas aquí creo que sea una cosa.
You are Brazilian.
Brasil.
You are Brazilian. Lamberto,
Esse é o Brasil da audição, como se diz aí.
Lamberto, thank you very much. It
You're
was an
welcome.
honor
Thank
for
you.
me to have this talking with you.
Thank
What's
you.
very important for me.
Thank you.
Thank you for all you
Yeah.
have bring to us with
You are a
Ozone
very friend
therapy.
of mine. You are
Yes.
very expert. I know you are very knowledgeable. I am here just because I have a great esteem about you and about
Thank
your
you
work.
very much, Lamberto.
Thank you.
Thank you. Lamberto, thank you.
See you.
You guys, please share this video with everybody you know. You see here how much knowledge, and this is just the beginning. Ozone therapy is the health of future.
Exactly. Thank you to all.
Thank you very much. So share this video, give your like, okay, and join us for the next journey. See you guys. Thank you.